I'm Lauren Stahl, head of sales at Komodo Health. Welcome to For the Health of It, where we bring together some of the world's top scientists, analysts, and health experts to discuss the biggest challenges in the healthcare industry today. With us today is Tejas Inamdar, head of strategic partnerships at Turquoise Health. Turquoise Health uses Komodo's healthcare map to enhance the Turquoise platform. The goal is to better understand patient journeys and the full constellation of costs associated with healthcare encounters. Turquoise and Komodo have been working together for over a year now, and we are very excited to have you on the show. So welcome aboard.
Thank you so much for having me, Lauren.
You've been in the healthcare space for many years, and in the last 10 years, you've worked across engineering, product management, marketing, and business development. Is there really anything that you haven't done? Can you tell us briefly about what brought you to Turquoise?
Sure. Healthcare is an incredibly broad space, and I've just kind of followed my curiosity. I've spent the last 10 years in different pockets of the healthcare industry. I started off building surgical devices in women's health, and later in cardiology. It was really fascinating to be involved in the product development process from start to finish in a highly regulated industry. Over time, I wanted to scale my impact more rapidly, and so I transitioned into the digital health world, where I helped build more consumer-friendly products, especially for at-home care and diagnostics to bridge the gap between telehealth and in-person care. That's when I actually realized that a key missing piece for building consumer-friendly healthcare experiences was price transparency. That's what brought me to Turquoise Health, where I'm leading strategic partnerships, and we're helping to make healthcare prices much more accessible.
One of the key elements of your role is championing price transparency in the healthcare industry. I'm sure many of our audience members will have experience, either personally or professionally, with that exact issue. Talk to me a little bit about how the old school way of pricing and why it can cause challenges for both patients and healthcare providers.
Yeah, we've probably all had that experience where we've asked for a price estimate for a healthcare procedure and have been told that it cannot be provided because they simply don't know what it will cost. The lack of price transparency is a big reason for that problem. Let's talk about the commercial market, because that's really where some of these problems crop up the most. Insurers and providers negotiate prices independently. These prices have been closely guarded industry secrets. All of these negotiations depend on who has access to market benchmarks and who has access to more leverage. Access to benchmarks has traditionally relied on claims data, but claims data can have some gaps and is often a retrospective look of what was paid rather than what will get paid. Healthcare professionals, in many cases, do not have the visibility to prices for services and drugs that they're prescribing. And the negotiated rate does not reflect the true out-of-pocket cost for the patient. For the patient to know how much it's going to cost them, they need to account for their deductible, their copay, their co-insurance, in addition to the negotiated rate. And patients themselves have no way of communicating all of the services that they need. So that's what really creates this problem around old school ways of pricing in healthcare.
Absolutely. Now, you mentioned some of this in your answer, but I want to go into this in a bit more depth. Now, if that's the old school approach, what does the new school of healthcare costs and pricing look like? What is Turquoise hoping to do with its mission?
Yeah, the Turquoise mission is to eliminate financial complexity in healthcare. There are new price transparency regulations that have mandated hospitals and payers to disclose previously secret negotiated rates. Even though these rates are public, they're incredibly hard to access and interpret. I like to give an example of this data as a public library, but with a secret entrance. Turquoise has aggregated all of these rates and made it possible to compare and analyze the data so that the industry at large can directly leverage the data instead of reinventing the wheel. Turquoise is also working with hospitals and insurance companies by helping them create patient estimator tools. We're also helping build them, understand, and build easier ways to package and price healthcare services so they're easier to compare and shop.
Yeah, absolutely. We've had a lot of fantastic discussions with our For the Health of It guests around health equity, specifically access to care and what stands in the way. We know that rural communities tend to be at a substantial disadvantage, largely driven by proximity to healthcare services and specialists and limited access to the internet. Where can technology and data play a role in addressing these challenges?
Yeah, so I spent some time earlier in my career working on telehealth and virtual care solutions. And I worked on at-home care solutions and diagnostics. There is an incredible potential for us to leverage these new tools to provide more equitable access to care. We need to make sure that all of these new tools are not just looked at as alternative care options, but they're brought into the mainstream. We need to make sure that the data and insights that these new tools are generating are connected to the patient's health records themselves so that they provide a seamless healthcare experience, and not just a new siloed data set that doesn't really connect with the rest of the healthcare experience.
Absolutely. And following up on that thread, what's the role that industry experts and thought leaders can have when having conversations about transparency, technology, and also equity?
Yeah, as an industry, I think we need to keep the patients at the center of all of our decisions. We need to continue the momentum on regulatory strides we've made over the past few years and make sure that we don't relapse into old ways of thinking. We have to provide the right support structure and clear guidance for the industry to comply with these new regulations. The ones that I'm most excited about are around kind of the No Surprises Act, good faith estimates, um, the need for standardized data formats, and all of these things will make price transparency much more accessible, much more actionable. And interestingly, when we kind of look back at the rural conversation we had, hospitals in concentrated markets and rural areas were actually the slowest ones to comply with transparency regulations. The resources needed to comply with these regulations can often be quite burdensome, especially if you're a much smaller hospital that does not have the resources of a large health system. And for patients, individuals, consumers in those rural areas, many consumers actually delay care because they're worried about what it's going to cost them. Um, just making this data accessible and comprehensible to the individual population will really help these patients get the care they need without having to worry about costs.
Yeah, absolutely agree. And also, if this were an easy problem, it would have definitely been solved by now. But great to see the work that you and the team are doing to help bring more transparency and solve that as well. Now, with that in mind, can you talk a little bit about the technology? Nothing proprietary, of course, but the technology vision that you have and how you are approaching designing solutions for these complex challenges.
Sure. Yeah. Yes, fixing healthcare is a very hard problem. I think healthcare represents almost 20% of the US GDP, and it is just unsustainable. We spend almost a third of this on administrative work, not real healthcare. So we have a big opportunity to use data and technology to improve the revenue cycle and the administrative work for payers, providers, and patients. We've always had a lot of data in healthcare. The problem is that the data is often siloed and hard to connect. And so our vision is to actually bring together all of these different complementary data sets and to use the power of technology to extract meaningful insights. When I think about complementary data assets, I think about quality data along with cost data. I think about um, meaningful information on provider directories, social determinants of health, understanding what drugs are going to cost, getting access to clinical data and understanding the outcomes associated with quality and cost and how they tie into the overall healthcare picture.
Can you talk to us a little bit about the catalyst for working with Komodo?
Sure. Yeah. So Turquoise actually gets access to millions of encounters of claims data from Komodo. We're using this data to help build a new vision for standard service packages. We're also exploring the use of this data to get a pulse on utilization and volume. Those are often not reflected in the price transparency files themselves. But these are key elements in a negotiation. So the Komodo team have been exceptional partners, and we've actually discovered lots of new opportunities for us to apply the data in new ways. We have this incredible opportunity to use claims data to identify specific providers and to validate the rates that have been posted by payers and providers and to bolster the confidence in these data sets.
We've been part of the journey with you all, and you continue to grow and expand. We continue to grow and expand, add new sources to our healthcare map, really enhance much of the work that we're doing. So we're excited to, of course, be in that journey and continue that growth, that expansion, that really challenging the status quo and helping to make sure that health equity is there in the most meaningful way on a go-forward basis. Now, one of the best parts of our For the Health of It interviews is the opportunity to hear from visionary thinkers in the healthcare industry, like yourself, about the future of the industry. In your view, to project 15 years out, what will change about how we understand the costs associated with healthcare and how those costs may or may not impact outcomes? Envisioning the next generation of healthcare, what does the future look like for healthcare pricing?
My hope is that we see more choice and competition in healthcare. I would love to see the emergence of true market-driven economics. The lack of transparency makes it impossible for supply and demand to correct prices in healthcare. As a result, healthcare prices vary widely. At a minimum, with the emergence of price transparency tools, I think we'll see the spread in healthcare prices contract. So as a patient, you're not left to the mercy of what your insurance company negotiated with, and you're not actually ending up with a much lower price or a much higher price, depending on the flip of a coin. On top of that, my vision is that we have a truly consumer-friendly healthcare market where patients are able to get upfront, pre-adjudicated binding prices for as many services as possible.
Yeah, big vision. We are here to be on that journey with you every step of the way. Anything else that you would like to share with us today?
No, I just want to thank you again for having me today. It's been a pleasure talking with you. Our team really values the partnership we have with Komodo and are really excited about everything we're going to do together.
Thank you so much, Tejas, for sharing your perspective on these critical and complex topics. It's been a pleasure talking with you today. To learn more about how Komodo Health is working to reduce the burden of disease, be sure to check out komodohealth.com. And for more on For the Health of It and stories about how we're transforming health, follow Komodo Health on Twitter, LinkedIn, and YouTube. Thank you all for watching For the Health of It.